I'm 46 and unsure if I am ready for a mini facelift or other surgery. Currently use Botox in forehead and some Restylane. I am unsure if I am ready for a mini facelift or surgery under my eyes. I have significant crinkling under eyes when smiling, but not when face is at rest. Some skin laxity in lower face and feel like my face is mildly sagging. I use Botox in forehead and have used Restylane once in lines between mouth and nose. I'm 46 and not sure what my next options should be.
Thank you for your question. You're 46 years old, you've submitted several very good photos, and you describe in your photos that you get some crinkling under your eyes when you smile, and that you've done some Botox, you've done some Restylane, and you're considering some issues related to your lower face and the skin being a little bit laxed, and you're considering whether or not to have surgery. Well, I could certainly give you some opinion about how I approach people like yourself in my practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in procedures to help people with facial aging. In fact, I've written books about it, and I've been a source for media regarding this topic. And I can tell you that over the course of 20 years, I personally have gone through many different evolutions with the approaches that I have for people like yourself. First of all, it's important that you just kind of understand some basic principles, because it's natural when you have some concerns for doctors and non-doctors to offer you all kinds of solutions from their bag of options. But when you get to the principles of what's happening at the age of 46 for you, basically related to age and genetics, two things happen with facial aging. One is volume loss. We lose bone, muscle, and fat. In fact, a few millimeters of bone loss can actually be a couple of hundred milliliters in actual volume loss. Now, that being said, there's also laxity, loosening. The tissue that supports the face gets thinner. The skin becomes thinner. So, a few years ago, we would have discussed options such as limited facelift. But nowadays, when I look at someone like yourself, I try to figure out when is the right time to do surgery and when is not the right time. I think that with someone like yourself, in our practice, we would probably consider, to address some of these issues, a combination of something called structural volumizing. And structural volumizing in our practice is an approach where fillers, such as Restylane that you're familiar with, but rather something more thick or more substantial, like Juvederm Ultra Plus or Voluma or Restylane Lift, would be applied in a way that is at the bone level. Now, this is a deeper level than what fillers are generally used in. And the point of that is that by doing that, you're restoring some of that lost volume. It's, in essence, what we're trying to do is restore angles and projection. And it can look very, very natural, and it can actually look like you've had a facelift. Because what we're doing is we're actually adding volume to structure, hence structural volumizing. In addition, we have different options to help skin quality. This includes something like platelet-rich plasma, fractional laser treatments, non-surgical skin tightening using 1064 YAG laser for dermal tightening as well as deep tissue tightening. So even for a surgeon like myself, what's really nice is we have new options which help me do the things that I can't do with surgery, and do it in a way so that we can optimize the results. When surgery is indicated, surgery is appropriate. But I find that a lot of people in their 40s, women in their 40s, benefit from this type of approach. Sometimes there's a blended approach. There's a procedure called a beauty lift, where actually we combined limited facelifting with structural volumizing. So at the same, as you can see, that there's a lot of ways to approach this issue. You'll find that as you do your research, people are going to be coming at you with all kinds of ideas, and I think that you have to kind of figure out what makes sense to you and what you're comfortable with. Never get sold on a single solution. I think it's very important to understand that in the aesthetic field, there are a lot of people who are selling a lot of things. As a veteran, as an experienced cosmetic surgeon, where I offer everything from skin products to minimally invasive to lasers to advanced surgery, in my practice what we figure out is how to help our patients optimize their solutions. So learn more about your options. Think about the idea of volume correction at the structural level and some skin quality improvement. This is the age of maintenance, and it can make a real difference if you are committed to doing these things. So I hope that was helpful. I wish you the best of luck, and thank you for your question.